Hey everybody, it's Eccentric Mo here. I am 3 weeks post-op, so I wanted to make a video about that. So as you saw in my week 1 post-op video, I was pretty out of it from the hydrocodone, and I was really groggy. I really spent most of week 1 sleeping and just resting and relaxing and like watching YouTube. But honestly, looking at a screen was kind of difficult for me. The hydrocodone made me really woozy if I was trying to focus on a screen. So honestly, I slept most of week 1. Week 2 was kind of in between. I was on the hydrocodone like once or twice a day. I would take it like before bed to help me sleep. And other than that, it was mainly just ibuprofen. So I was able to kind of lounge around and watch Netflix or poke around on the internet and all that. At the end of week 2, I started feeling closer to normal, so I was able to function a little bit better. Right now, the pain is very manageable. I'm only on ibuprofen as needed, so if I'm up a lot working, depending what kind of motions my work requires, I will, take more pain pills. Sometimes I can go quite a bit before I even notice any sort of tenderness, so um, that's that. I worked from home 11 days post-op, and then I went to work 13 days post-op. But I was honestly more concerned about the driving than the pain management or anything like that because my commute is an hour one way, and I would get so nauseous um, in the car at first. So, yeah, that was my biggest concern in returning to work, honestly. Okay, so the chest so far, let's take a look. Okay, so obviously I'm still taped up here. Um, the swelling has gone down a lot. This side is still more swollen. The bruising has gone down a lot too. Towards the second week, there was a lot of bruising. My chest looked kind of messed up for a while there. But after a couple weeks, most of the swelling went down. Um, this side still feels kind of boob-like because of the swelling. I don't know, just the way it's shaped, it's more round or whatever. Now the swelling is more right around where the nipples are, where before it was kind of like this whole full round feeling. It's just really more here. The tenderness is all more around the nipple area, which I'm assuming is a good thing. I'm assuming that means the other areas are healing, but I don't really know. I will see the doctor next week so he can let me know how I'm doing. Last time I saw him, he said I was healing really well and I was really far ahead of the game as far as healing and most people are concerned. So I think that's just about it. Um, oh, nipple sensitivity. Well, so far, I've heard time helps, but so far, this side, I have like most of my sensitivity. I can feel it a lot. Uh, I wouldn't say it's exactly like it was before, but probably like a 4 out of 5. I mean, it's really close, so that makes me really happy. This side is I can barely feel it, honestly. Um, I can feel a little bit every once in a while. I can feel cold over there, so I'm assuming I will get more sensitivity back as time. I mean, this side was always kind of more messed up. There was a lot more swelling and bruising over here, so I'm assuming this side just had a rougher time. And I was told my incision there is not as clean as on the other side, so for whatever reason, I think this side was just a little rougher. Maybe over time I will slowly gain some more sensitivity there, but honestly, the fact that this side is almost like it was before, I'm totally fine if I really don't get more sensitivity over here, because I do like nibble play, but I'd almost rather have one that worked really well than like two ones that like I could kind of feel. Uh, so yeah, that's my thoughts there, and obviously I'll update with you guys more on the sensitivity as that goes. I cannot wait to get like all these tapes off. I still have to wear a compression wrap, which is not really that exciting, but it's there to fight the swelling. And I really just can't wait till the swelling goes down, because otherwise, I mean, it still kind of feels like I have tiny little boobs. But it'll go away. It'll just take time, and I have to be patient and blah 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 blah. I technically, according to the instructions, I can start dog walking for exercise now, which is not really exercise, but I've honestly decided just to lay low at this point. I've already been unable to work out for a couple months due to my strained muscles and, top surgery, so it's kind of like, what's a couple more weeks at this point? Because I read online that getting your heart rate up and your blood flowing when you're recovering from surgery, it can affect your scars. It can affect how your scars heal. So I was just kind of like, what's the point in pushing it at this rate? Also, I just want to mention that my range of motion has greatly increased over the weeks. Before I couldn't raise my arms up like this. I could do it like here, but not quite all the way up here. I can actually sort of raise my hand like, teacher, teacher, I have a question. This side hurts a little bit more. I don't know if that's just because this side's more numb, but so one side pulls a little bit more. But for the most part, my range of motion is pretty good. I can reach things a lot more now. I can, open the cabinets and take like a big stack of dinner plates, whereas before that was kind of difficult. I can actually help with dishes now and stuff like that, so things are getting better there. Well, that's all for now. Later.